we'll just get started introducing the session, and then more people may join. So I'm Victoria. I'm the resident co-chair on the Advocacy Committee with some of my co-chairs here. We just wanted to start with a land acknowledgement that we're here virtually on the land of the Native Americans who have lived here in California before us and continue to live here. So we wanted to start by introducing the session. We're here today to learn about legislative advocacy and how to kind of put forth our thoughts about issues in front of our legislators. I know that legislative advocacy can seem really intimidating, so I just wanted to start with a reminder that we are all already advocates. Every time you address the medical and social needs of your patients and families, every time you explain a complex medical issue to a family in a way that's easy for them to understand, or speak up for them in the hospital, speak up for them for their insurance companies, you are already engaging in advocacy, and you already know so much. You're the experts that the legislators listen to for your thoughts about these issues that face the health of our children, and you already have the skills needed to be successful. And I just wanted to show you some data that medical doctors have always been some of the most trusted professions. And it might seem like in this day and age, perhaps trust is eroding a little bit. You might have gotten some different reactions in recent years, but there's still data from a recent Gallup poll showing that we still are, despite a sort of 14-ish point drop in trust amongst medical doctors, we still are amongst the most trusted professions, and patients and families really look to us for advice still. And if you click again, you'll see another figure just showing that while some of the trust has indeed been affected, we still are quite trusted, and our thoughts still really matter to our patients and our families. So I am really excited to introduce our agenda for the evening. We'll start with a presentation from the AAP lobbyist, Bryce Docherty, and then we'll transition to some breakout groups on some of the most pressing issues of the day. So we will have a group on vaccines led by Dr. Dean Bloomberg. He's a professor and chief of infectious diseases at UC Davis. He's provided expert testimony at many legislative hearings in California. He's participated in national and international advocacy efforts. We will also have a group on Medi-Cal led by our own AAP California Chapter 1 president, Dr. Nikki Webb, who is also a pediatric hospitalist at Valley Children's in Madera, and a huge leader in gun violence prevention advocacy. And then our third group will be on immigrant health. So my amazing advocacy committee co-chairs, Dr. Fong Gomez and Dr. Layton, will be filling in for Raul Gutierrez. And then after that, we will kind of come together to practice what we've learned and then have some closing and tell you about some upcoming opportunities as well. So I'm super excited to introduce our first speaker of the night, Bryce, who is a legislative advocate, a lobbyist for AAP California. He's a total expert at preparing pediatricians to advocate for policy change in front of legislators, and absolutely fundamental to our advocacy days every year. He's also the founder and CEO of TDG Strategies, a consulting and government relations firm, and for nearly 30 years has represented healthcare and medical interests before all areas of state government. So I'm super excited to hand it over to Bryce to teach us a little bit about legislative advocacy.
Excellent. Thank you, everybody. Just to check, can everybody hear me okay? Yes. Okay. Thumbs up, heads nodding in the affirmative. Awesome. Thank you very much for the opportunity. I appreciate that, Dr. Chi. I'm also glad to see some familiar faces and at least some familiar names. Dr. Bloomberg, I've seen at the Capitol a number of times. Looking forward to hearing him this evening. Also want to give a shout out to Dr. Vanderlist, who I see here, who is an excellent advocate on behalf of pediatricians, particularly Chapter 1, not only locally here with the city council, but her role at UC Davis. not only with the residents, but the communications outward facing role that she has there. And not only the fact that she's a wonderful pediatrician and my daughter's former pediatrician. I've had the pleasure of working with her husband in the advocacy space. So it's good to see you, Dr. Vanderlist, and it's good to see many of you and seeing many familiar names. I also hope that
Thanks
I
for
get
the shout out,
all of,
Bryce. I don't know if you know
hey,
we have a new baby, so I'm putting him to sleep, but we have a 10-week
what,
old. I'm happy to participate, but that's why I've got my camera off over here.
is that the first one or is that the second one?
This is our second.
Oh my goodness. Well, I love it. Pediatricians having babies. I love it. Almost as ironic as OBGYNs having babies. So anyways, I hope I also get to see many of you at our advocacy day coming up on Tuesday, May 6th. I'll be participating in the resident training piece on the 5th. We're going to have yet again another robust advocacy day in Sacramento on the 6th. The speaker lineup looks fantastic. We not only have California Surgeon General Dr. Ramos attending, but we have the new Senate Health Committee Chair, Dr. Carolyn Menjivar, from the Los Angeles area coming. So it should be an excellent lineup. And I think you're very smart and very forward thinking to allow me to instill upon you a couple nuggets that I've learned over my 30 years of doing this advocacy and representing physicians. And my hope is that I demystify this process for you a little bit, and you do get some tools that you can deploy not only on Advocacy Day, but hopefully in your local communities, like Dr. Chi said. And you are truly what I call the street heat. And my job as the lobbyist oftentimes is really to get AAP California to the goal line. And if anybody's a football fan, you know, when you do the goal line stance, it always comes down to kind of the tush push. And you guys are the ones that do the tushy pushing to break that plane. So I appreciate it. And just, I know we got started a little bit late, but just a time check, how long do you want me to speak for? It's 7:14, 7:40?
Yeah, 7:40. You can take a couple more minutes if you want.
Okay, 7:40, perfect. Well, I'm a lobbyist, so I can say this, I can say everything I need to say in 90 seconds or 90 minutes. So I will do a hard stop at 7:40. Unfortunately, AAP does not pay me by the word, so we will just focus on the subject matter at hand. Little bit just briefly about me. Not only do I represent the AAP California, I currently have 4 clients in my stable. My firm solely practices in the healthcare medical space. I've only represented healthcare medical providers. I've never represented health plans or insurers or pharmaceutical companies. I represented one medical device company for a while, but that was a horrible experience. So ever since I was a baby lobbyist, born and raised in the physician space, prior to lobbying here in California, I was a lobbyist for the Michigan State Medical Society, which is Michigan's version of CMA. I came out to California because Michigan is a fantastic place to be from. And I don't really complain about the rain out here because you don't have to shovel it. So when I came out here, I started working with the California Medical Association, worked there for 6 or 7 years, launched my firm the first time. Then I got acquired by KP Public Affairs, which is the largest lobbying firm in Sacramento, therefore the state, therefore the 5th largest economy in the world. And I established and built out their healthcare advocacy practice. And then COVID happened. And I think what we all learned from COVID is we all need to be a hell of a lot more nimble. And gone are the days where we all sat down in January and did our, 18-month, 12-month strategic plan. We had to shuffle around resources, and I felt the need to go back out on my own. And so here we are with TDG strategy. So I'm kind of like that commercial. I know a thing or two because I've seen a thing or two. And so what I plan on imparting with you today is not necessarily something that is learned. It's instinctive, and hopefully you learn some things that not only you understand the rules of engagement, but hopefully you have some tools and some skills and the ability to critically think about some of these issues and overlay the politics to that, and hopefully that'll help you see around a couple corners. So next slide, please. This is just a level set of what the legislature looks like. We have two chambers in the California legislature, similar to Congress. But like California, we always like to call it something different. So it's technically the Senate, but it's also called the Assembly. It's not called the House of Representatives. We call it the Assembly. Both the Assembly and the Senate have what we call supermajority. So supermajority means both chambers have a 2/3 majority of Democrats over Republicans. In the Assembly, they have what we call a giga majority, even more Democrats than senators by a large margin. So you can see there on the graphic, we've got 60 Democrats in the Assembly and 19 Republicans. We've got one vacated seat where we'll be having a special election. And then in the Senate, we have 40 members. They actually picked up a couple seats this election cycle. The balance was 32-8, but they picked up 2 seats. They picked up 1 seat, and then 1 Democrat switched from Democrat to Republican from the Central Valley. So there's 30 Democrats and there's 10 Republicans. Why is a supermajority important? A supermajority is important because the Democrats, when you have a supermajority and a 2/3 vote, you can do principally 2 things. One of which is you can pass a budget without the need for Republicans, because passing a budget requires a 2/3 majority vote. You can also raise taxes, which is something that requires a 2/3 majority vote. And if you have legislation that contains an urgency clause, meaning if that bill was to pass and be signed by the governor, that legislation would take effect immediately. And in order for a bill to enjoy an urgency clause, it has to pass with a 2/3 majority vote. As you can imagine, that is a tool that's important when we have certain urgency matters. This year in particular, we've got a special session on, I guess, Trump-proofing California. We've also had a number of bills that required urgency statute related to the LA wildfires. And so we're only, just into our 4th month of this legislative session with 36 new members of the legislature who have never held elected office here before in Sacramento. And so as you can imagine, things like learning about advocacy and doing ledge days and educating the legislature is not a one-time event. It's an ongoing event. And the whole key to all of this that we talk about, the one takeaway that I want you to know is, if you go back to the other slide, please. This is a picture of then Governor Arnold Schwarzenegger and then Speaker Assemblymember Fabian Nunez from Los Angeles. Obviously, Schwarzenegger being a Republican, obviously Fabian Nunez being the leading Democrat in the Assembly. They were best of friends. They were bosom buddies. They worked on a lot of pieces of legislation together. They weren't dating or anything that this picture might suggest. But the point here with this is it does come down to relationships. I think we need to understand that we have a lot more in common than we do not. And I think a lot of people ask me, well, how come the California legislature can't get as much stuff done as we think that they should, right? And I tell them, because you have 120 members of the legislature, and if you put 120 people into a room, how many things would you expect them to agree on? And when you overlay this with politics, you have to understand that California as a state represents some of the most conservative Republican districts in the entire country and some of the most progressive and liberal districts in the entire country. So we have places like San Francisco, former Speaker of the House there, Kamala Harris, Gavin Newsom, really kind of the blue wall, if you will. And then we have parts of the state that are hardline Republican. Some of the places in the Central Valley, not so much in Orange County anymore, but if you're paying attention to the politics and if you look at the politics, the coastal areas of our state are largely Democratic and the inland areas are largely Republican. Everybody kind of gets dug in. There's probably 80% of the legislature are in safe seats. And so oftentimes they kind of retreat to their own end zones, but everything is based on relationship. I think what Dr. Chi was saying is a great point, which is physicians are still one of the most trusted professions in the entire country. Use that to your advantage. I would liken the relationship component of politics and advocacy to kind of your bedside manner, right? We do understand that there is such a thing as political science. And all of you are scientists, and I've been representing scientists for 30 years, and you are trained A plus B equals C. But in this business, A plus B may equal C, it may not. It may equal C in August, but not in April, and that's okay. Or A plus B might equal F, that's okay too. But at the end of the day, there is a science to this. You can introduce different variables to try to predict human behavior, but it's also more so, and I want you guys to really focus on your bedside manner. And that's the method and manner by which you go about your work, how you connect with your patients, the way you can alleviate people's fears, the ways in which every single day you're advocates for your patients because you have to convince them to do things that they may not necessarily want to do. And I've talked to enough physicians to know that, particularly pediatricians, particularly children, they are horrible communicators. And one thing I think that you guys all know about patients, particularly little ones, is they have a tendency not necessarily to lie, but not necessarily tell you the whole truth. So apply some of that to your advocacy and you'll be in great shape. Next slide, please. So they basically say in business, if you've ever taken a business class, if you can't diagram it, it's not possible. So this is actually, it's a legal size sheet of paper. It's 11 by 17. This is basically a diagram of the legislative process, how a bill becomes a law. I have been using this slide and I've been studying this document for 20 plus years, and I have no idea what it means or how it works. The one thing you do have to know is legislation is introduced in either the Assembly or the Senate. Okay. Those bills, each piece of legislation goes through at least eight processes in the legislative process. And the legislative process is dictated by joint rules that are adopted by the legislature. So everything is deadline driven. So we're in the month of April. And what that means is all the bills that were introduced in the Assembly and all the bills that were introduced in the Senate must be out of their initial policy committee in their House of Origin by April 31st. Then they go to the Appropriations Committee. They have to be out of that committee by a certain time. Then they have to go to the respective floors if they're still alive. If they get off the respective floors, then the Assembly bills go to the Senate bills go to the Assembly, and that process repeats itself. If you're able to get your bill through the other House, if there are any amendments that were taken in the other House, it has to come back to that House of Origin where they have to concur in the amendments that were taken in that other House. If you're lucky and you don't have to take any amendments in that other House, your bill automatically moves on to the governor's desk. So once the governor receives all of the bills, he or she has basically towards the end of session 30 days by which to either sign or veto any of the bills. And I have never known a governor in all my years of doing this who has not either affirmatively signed or vetoed a bill. Technically, if a governor does not take action on a bill within 30 days, it automatically becomes law without their signature. I have never, ever seen that happen. I will tell you, there's probably about, give or take, 3,000 bills that are introduced any given year. About 700 to 800 of them make it to the governor's desk, and he signs probably 60% of them and vetoes about 40%. So if you're able to get a piece of legislation through that entire process and onto the governor's desk, and the governor signs that bill and it's enacted, that is an amazing accomplishment and something that should be celebrated. In my opinion, I would go toe to toe with any lobbyist. It's much more difficult to pass a bill than it is to kill a bill. There's 8 places in the process where you can kill a bill. So that's kind of how the process works in a nutshell. You are going to be, if you're participating in the AAP Advocacy Day, it's the first week of May. So all of the bills that we will be advocating for, priority bills, will have already been through the initial policy committee, and they will be on their way to the Appropriations Committee. So all of them will still be active. Next slide, please. Might want to jot down this website, leginfo.legislature.ca.gov. This is an excellent resource for you to find information on hearings, what the legislative schedule is for that day. All of the bill information is on there. You will find bill information, bill text, amended text, committee analyses, vote counts, anything and everything that's published related to a piece of legislation, you will be able to find on this website. You can also scroll back to as far as 1999, I think. So it also provides kind of a modern history archive of any and all legislation. So this is an excellent resource. Just a little quiz hint. This is a website you're going to want to be using and resourcing when you do your breakouts on the particular bills. There's also information here on California law. For example, if we're referencing Business and Professions Code 2725B2, which is the provision in the B&P code section in the Nurse Practice Act, which basically requires an order from a physician, dentist, a pediatrist, or clinical psychologist before any nurse can order or administer any sort of therapeutic agent. If you want to research any parts of California law, you click on that California law page and you can query by code section, health and safety code, penal code, and it's a great resource for you to actually, if you really kind of want to get wonky and kind of want to nerd out on California law. Next slide, please. Another website you want to write down, calmatters.org/legislator/tracker/home. Just rolls right off the tongue. That is a great website resource for you to find all the information about the current legislature. You have information on there about their bios, where their district, demographics on their last election, how much they won by, the percentage of Republicans and Democrats in that district. Any and all information on any particular legislator you can find there. I also think that they have populated it with information on who their major campaign contributors are, and I think they're even starting to track certain vote counts. So again, this is probably going to be something you're going to be using in your breakouts, but before you meet with any legislators on a ledge day, you have to make sure you do research on that particular legislator. This is an amazing resource for you to find out that information. I use this all the time. I also have a different software vendor that I use that gives me all the secret information. But also, just to be honest with you, if you just wiki these people, there's a ton of information there too. And most importantly is you learn some personal information. Just a lobbying trick of the trade. I know all of the legislators' birthdays, so I send them a birthday card every year on their birthday. It's just a simple reminder that I'm watching them. Next slide, please. Just a couple of quotes from former legislators, just to give you a flavor of how the legislature orients towards certain issues. You can be right all day on an issue, but the politics will get you in the end. And we need to remember what the Latin derivative of politics is. Poly meaning many and ticks meaning blood-sucking insects, right? So this is where a lot of physicians and scientists get tripped up, and a lot of physicians have told me over the years, well, Bryce, clearly you're not explaining this properly. If you would just let me come to Sacramento and talk to them, I could explain it to them and they could understand it. No, I'm explaining it perfectly fine. They understand exactly what we're saying. And they know that we're right, but politics is this is about politics. And this is an issue with regards to SEIU. SEIU is one of the strongest labor unions in the entire state. They represent 900,000 state employees, workers in your hospital facilities, and they annually give, I don't know, and every election cycle, it's somewhere between $10 to $15 million a year. Former Democratic State Senator Sheila Kuehl, who was also former Los Angeles County Board of Supervisor, also former chair of the Senate Help Committee, says, if I piss off SEIU, I'm vulnerable, and I need their help in a contested election, not just money, but the boots on the ground, then I'm going to think twice about crossing them. So when SEIU is opposing your bill, and oftentimes they oppose a lot of bills in the healthcare space, that's a problem. That's not a policy problem, that's a political problem. And SEIU, not only is it important to give to political action committees, I know AAP California does not believe in it. They do not have a PAC. I'm trying to change that, but nonetheless, it's also not just about political giving. It's also about the boots on the ground. And so without the political giving, this is where you become even more important. Walking precincts for a legislator. I guarantee you right now, there are members of SEIU that are licking envelopes, inviting people to the fish fry next week. I guarantee you tomorrow, there's going to be members of SEIU or family members of SEIU that are mowing legislators' lawns, right? So this is the kind of street heat that I'm really talking about. Next slide, please. Oops, that got cut off a little bit. But anyways, here's the lobbying dilemma, right? If you look at the committee analysis of any bill, and you will as we do this exercise, regardless of how long the committee analysis is, if it's 5 pages, if it's 30 pages, what everybody does is they rush to the last page of the committee analysis. Why do they rush to the last page? The last page at the very bottom, it says support. It lists everybody who's in support, and then it lists opposition, lists everybody in opposition. You can predict probably 90% of the votes on any particular bill by just looking at that particular page, right? Oftentimes, you know, I'm embroiled in a couple right now. Let's say scope of practice issues, for example, right? A lot of people love their optometrist. A lot of people love their ophthalmologist. A lot of people love their nurse practitioner. A lot of them love their pediatrician, right? So the reality is, oftentimes legislators get stuck. And what folks don't understand is legislators can either vote aye on a bill, no on a bill, or they can lay off. They don't have to vote. And I have literally had legislators say this to me. Half my friends love the bill, half my friends hate the bill. I'm going to vote with my friends. And my main job is to count votes. So, you know, it's a challenge sometimes. And folks need to understand is they don't have to vote for a particular bill. If they lay off, that's just as good as a no vote in my mind, because you need affirmative votes to pass a bill. Next slide, please. Here are some goals with your visits. I'm going to run through these like super quick, doing a time check on myself here. You know, these are the goals. You advocate for a policy to improve your patients' lives. Patient-focused advocacy is really what we are all about. There are economic advocacy issues that we do, but that's always shrouded in increasing access to provide better services. Look at Prop 35, look at Medi-Cal rates. You know, if you're in a field or a business and you're losing money and you're increasing your volume, all you're doing is losing money faster. It's all focused around the patient experience. Build relationships, we talked about that, which is key, and exercise your right as a constituent of our democracy. I'm glad that you guys are doing this. I hope you continue to petition your government. If you do not petition your government on your issues, somebody else is petitioning the government on your behalf, and it's probably going to be a position that you don't necessarily agree with. Next slide, please. Here's some prep work for your meetings. Just know your subject matter. Know the substance of what it is you're talking about or the regulation. Why is it important? What happens if it passes? What are the consequences if it fails? The reality is, and I'm not here to destroy anybody's idealism, but the legislator's only motivation, it's not to help you. It's not to increase access to care. It's to get elected and to get reelected. So what you need to do, your job, if it's something that you like, you need to explain it to the legislator in a way that if they vote for it, it will help them get reelected. It will make them look good. They will be the hero. They will be the champion. Now, if it's something that we don't like, you need to explain it to them in terms where if you vote for this, you are putting your constituents in harm's way. And this is going to be bad for your constituency and your district, and it's more than likely going to hurt your chances of getting reelected. Next slide, please. Know the legislator that you're meeting with. I referenced that other website. Which committee do they sit on? If you're talking about a healthcare issue, do they sit on the health committee? Do they not sit on the health committee? What's their background? Are they a rice farmer? Are they a physician? We've got 3 physicians in the legislature. You know, one is a family physician, Dr. Jasmine Baines from Bakersfield. One is Joaquin Arambula, ER doc from Selma, from the Fresno area. And the third one is Dr. Akila Weber Pearson, an OBGYN from San Diego. Everybody else, they are not particularly healthcare experts. So know who it is you're meeting with. See if you can figure out how they voted on the last bills. That will help you predict how they'll orient towards the other bills. This is a slide that says everything I learned in kindergarten. Be professional, be accurate, be clear, be timely. My secret is show up 5 minutes early if you can, a couple minutes early if you can, because if the other meeting wrapped up early or the other meeting was late, you might get a couple extra minutes. Never give impartial or incorrect information. Never make up any facts or statistics. If you're in a meeting, somebody asks you a question you don't know the answer to, it's very, very hard for physicians to do this. But listen, here are 3 very, very important words. I don't know. It's okay to say, I don't know. I'm not sure. Great question. Let me get back to you. Make sure you get back to them. Make sure you circle back with me and say, hey, they asked a question about this. I'm not sure. We'll get them the information. Don't make it up on the fly. Next slide, please. Prepare the analysis of the bill. Prioritize your arguments. Most of your meetings are only going to be 15 minutes. Okay, you only get 15 minutes to talk about 2 or 3 bills. And that's after the glad handing of the, you know, how are you? Oh, where are you from? Oh, and then they want to digress and talk about, you know, the LA Dodgers or this or that, the other thing. Prioritize your arguments. Also, you know, do the research on the opposition. My job oftentimes is to know my opposition's arguments better than even know my own arguments, because they're going to ask you, who opposes the bill? Oh, they do? Why do they oppose it? Oh, okay. Well, what's your answer for why they oppose it? Next slide, please. Not so much. I don't want you to get too involved in the political considerations, but also, you know, you're also probably not going to be in a position to be negotiating any sort of amendments, but I do want you to know that it is important to look at the dynamics, the political dynamics of those particular districts and of that particular legislator. Are they in a swing district? Did they win their race by a close margin? Are they in one of these very conservative districts? You can probably predict, you know, 90% of the votes by knowing, you know, 80% of how those elections kind of turned out. The other thing that you should know, that as on your behalf and others in the Capitol, you have to be very, very shrewd on how you negotiate. And the number 1 rule in lobbying, the number 1 rule is do not ever tell anybody how you lobby, because you might be on the same side with them this week or this year, but next year you might be on the complete opposite side. Next slide, please. This is just when you have your meeting, you've got the 15 minutes, 5 minutes for intros, 5 minutes for substance, and 5 minutes for Q&A. Introduce yourself, introduce the group, you know, humanize the story. You're physicians, you're always going to have the upper hand. You're going to know way more about the issue than they're ever going to understand. Anecdotes are very good. Anything you can pull from your experience is helpful. Make sure you make an ask. That's important. You're there and they're going to say, okay, thank you for talking about this issue, this bill. Like, what do you want? What's your ask? And so probably they're all going to be support bills. You're going to say, we're asking for your support on AB 82. Next slide, please. You're probably going to be a leader of your group, the leader of the group, you know, introduce yourself. I'm a pediatrician. I'm from this particular area. Share a story, illustrate how what it is you're talking about is relevant to your practice. Ask them if they have any questions. When you're done, ask them if you can be a resource to them. Do they have a healthcare advisory committee in their district? Is there anything that you can engage with them on in the district? There's plenty of opportunities to do that, and that's oftentimes the easiest way for you to start developing a relationship. Come to their town hall meeting, ask them questions. They just need to, after they've seen you engage locally in the district 2 or 3 times, they will be recognizing you and they'll be able to pick you out of a crowd. Next slide. Keep the group very small. We do this intentionally. There's a silent rule in the Capitol, no more than 4 people in a meeting. These offices are very tiny. If you have more than 4 people, you're probably going to be doing your lobbying out in the hallway, which is horrible because everybody gets to hear what you're saying. It's super frustrating. Make sure you confirm your appointment, pick one spokesperson, always have a leave behind. We will have, when you come to our ledge day and any ledge day that I do, we usually have a folder, some leave behind information, leave a business card, leave your contact information, fit your message into 5 minutes, try and show up early, send them a thank you afterwards, and just make sure that you can be a resource for them in case they need it. Everybody loves the baby doctors. Next slide, please. Stay focused, try and redirect the conversation. Some legislators, if they're just disinterested in what you're saying, or you strike up a commonality about something, I guarantee you, I've talked to legislators at 4 o'clock in the afternoon and I said, can you remember who you met with this morning at 9 o'clock? And they can't remember. It's like clinic. Every 15 minutes, they're talking to somebody else about something different, right? So if they digress, you only have 15 minutes. If they digress, you got to redirect them. Try and anticipate any questions. Who doesn't like the bill? Well, what happens if, how would you respond to that? Follow up with a thank you. Emails are fine. They're probably going to be 90% of the time, they're going to be in there with a staffer. Get the staffer's contact information, send them a thank you. And at the end of the day, what I like to say about all of this is have fun, enjoy yourself. You are all enthusiastic physicians. You love what you do. You are brilliant human beings. You are healers. You make sick young people healthy. And if you just enjoy yourself, calm down and breathe and realize that they are just normal people, just like you, that will shine through and you'll be most successful. Next slide, please. Aha. 7:43, almost on the dot. Happy to answer any questions, or we can move on to the next segment. Thank you, Dr. Chi.
Okay, if there are no questions, we'll move on to the breakout groups. So I think our lovely staff will start setting up some groups. And then we are hoping that in these groups, you can, first of all, connect with each other and kind of make connections with other local advocates in your area. And then our amazing breakout group leaders will kind of help introduce you to the bills that they've chosen for us to pretend advocate for today. And then we'll just kind of discuss advocacy strategies in the groups and then come back together to kind of practice our advocacy.
Is there anyone else that will be sharing slides that would like me to make them a co-host for the breakout rooms?
Yeah, if you could make me a co-host, that would be great.
Sounds good.
Thank you.
Me too, please.
Great. Oh, and then as we're waiting for the breakout groups to open, I see a question. Bryce, I have a state senator who just opened his local office right behind my house. I'd love to hear suggestions for how to cultivate a relationship through the local office.
Let me unmute. Okay, here I am. With district offices, usually a legislator has one, if not multiple, district offices. What's important to understand is that a member of the assembly represents about 500,000 constituents. A member of the Senate represents about 1 million. So, you can do the math. That's simple math. Even I can do that math, right? That's why we've got 40 members of the Senate, 80 members of the assembly. They try and what we call nest 2 assembly districts into 1 Senate district. So what I would suggest is setting up an appointment in the district office with the district director. Introduce yourself, say, hey, I live right behind you. If the music's too loud, let me know. I make a killer paella. Whatever it takes to kind of get to know them, use them as a resource. But I would start with the district director and I would just basically say, look, I'm here. I'm a pediatrician. I'm engaged. I would love to come to your town hall. I would love to host you or your staff at my clinic, at my hospital, at my facility. I'd love for you to come in for an afternoon and see what it is I do. I would love to meet with you on a quarterly basis and just have coffee and talk about what's going on in the district. I'd like to tell you a little bit about, my practice and my patients. Your patients are basically like their constituents, right? And so not only are you a vote for them, but you are seeing their constituents day in and day out, and you have the ability to convince your patients to do many, many things, and they probably see you as a conduit for more votes. And we know, if we were paying attention, that the number one motivation of any legislator is to get elected or to get reelected. So start easy, don't overthink it. Introduce yourself, meet with the district director, and try and get a calendar of events they're having. And just as my first boss ever told me at the Michigan State Medical Society, the world is run by those who show up. So just show up.
Thank you so much.
All right, so hopefully, I'm not sure who's doing this section, but hopefully everyone has had a chance to review a sample bill and to come up with a little bit of information and some examples or some stories to share. For this portion, Bryce is going to play the role of a legislator, and we were hoping to have from each group a volunteer to sort of practice making a legislative pitch to a legislator around one of the issues that you discussed in your breakout group.
And actually, we can take the slides down so we can pin Bryce and each brave volunteer so everyone can see a little bit better. Thank you.
And please don't be scared. You are among friends and you are all well prepared for this.
I know the immunization group breakout picked a legislator. Did the other groups pick a legislator as well that I need to be? Okay. So the immunization group's legislator, I know. Who is the legislator for the other two groups?
Dave Cortese for immigration.
Okay. And the other one?
We did not pick a legislator.
Okay. I was in the immunization breakout group. Let's start with them.
Kat, do you want to go? Or do you want me to?
Okay. We're gonna have both Victoria and Kat help.
Sure. All right. My name is Dr. Katrina Marks. I'm a pediatrician in the Sacramento area, and I am here to advocate for our bill. Oh, I can't see people now. I'm here to advocate for Senate Bill 866, which would allow minors to consent to their vaccines. So as a pediatrician in training,
minors like under 18, or because sometimes I think healthcare that covers up to ages 24. So what?
Under 18.
Does that include 18 years old?
Yes. So where 18-year-olds can consent to their own. 18-year-olds are considered an adult and can make those decisions. This would be under.
Okay, so you're talking about minors under the age of 18. So you're talking about children all the way up to senior in high school. Okay, thank you. Sorry.
So as a pediatrician training, I work in multiple settings throughout the hospital, including our ICUs. And recently, I was taking care of a kid who had a brain infection, meningitis from a vaccine preventable illness. He was on life support. He was intubated on a breathing machine on multiple medications, keeping him alive because he was unvaccinated to this virus. So had he been able to receive the vaccine as part of routine childcare, he could have prevented this infection that, if he survives, will cause long-term side effects and problems throughout the rest of his life. And so because we know these vaccines are safe and because we know they're effective.
So I got 1 second. So we know they're safe. We know they're effective. How do we know that? Do we know that?
We do.
Okay.
There have been a slew of research that supports the safety and efficacy of vaccines. They do not cause long-term, the vaccines themselves do not cause long-term consequences in patients. They might be a little sore red, but that's how we know they're working. However, we know that they're effective in preventing the spread of disease and the spread of potentially life-threatening communicable illnesses, such as the one he had.
Okay, so I've got your materials here, which I appreciate. I'll look through them later. I want to pay attention to what you're saying, but is there information in here about some of the studies and the science around the effectiveness of the vaccines? And I guess if there's not, I've got Katrina here, who's my ledge director, who staffs me on these sorts of issues. And so I really want to, because I got to tell you, I'm not necessarily I don't think I'm gonna be able to support the bill, but I do want to understand the issue. And my reading of the bill, I've got a lot of issues around it, not just the debate around the effectiveness of vaccines. So any of the science, I mean, you're a pediatrician, so any of the science that you have or the studies or whatever, please get it to Katrina. So for the time being, I'll just take your word for it. So thank you. Okay, great.
I'm not sure if we have the nitty-gritty details in there, but if that's something you're interested in, something you want to dig your teeth into, I'd be happy to send more information your way.
Perfect. Thank you.
I don't want to take too much more of your time, but I just want to share that my office will always be a resource to you. If you have more questions about this bill, I'd be happy to answer them for you, and I look forward to sending you those articles we talked about.
Awesome. Well, I noticed the bill's up in committee on Wednesday. I haven't been briefed by our caucus consultant yet, but if I understand the bill properly, we're allowing minors, which you said are children humans under the age of 18 to consent to their own vaccines without a parental permission. Is that what it does? Okay. I've got some philosophical problems with that. I can't even trust that my 12-year-old I've got two kids. I've got a 12-year-old and I've got a 16-year-old. I can't even trust that they're going to be able to do their homework. I can't even trust that they're going to be able to like eat their lunch at school. So, I just have some fundamental issues with, and I want my kids, just like you do. I want my kids to be fully empowered and highly educated adults, and I want them to take ownership of their own bodies and their own healthcare. But taking the parents out of the equation is kind of a bridge too far for me. I mean, in my district, we are way medically underserved. I mean, everybody in my district, the most highly populated area for healthcare resources in Reading, and so there's many people in my district that have to drive hours to get to a facility in Reading to see a provider. And I if my child, my 17-year-old is driving 2 hours somewhere to get a vaccine of some sort, I better be damn sure that I know what it is. I mean, I remember when they were just babies and we were doing the wellness checkups and we had the card, and I knew, the COVID. I mean, and during COVID, right? We had the card that says the days we got the vaccines and whatever, and it was, then it was uploaded onto the phone. So how do you think that those vaccinations will be tracked? I mean, because sometimes, I'm always asked when I go to the pharmacy, did I get a flu vaccine? So I know it probably won't kill me or wouldn't kill my oftentimes absent-minded 15-year-old who might happen to get the flu vaccine a couple times because they can't remember. So do they get some sort of information or a card, or how will I make sure that they're not getting, vaccinated 6 times for the measles? Is there?
That part, I don't have the specifics for you. That is not really the scope of what I was prepared to talk about today. However, I'd be happy to send you more information about how that information gets recorded. But I just want to emphasize that we are not requesting that minors consent to anything that is beyond the scope of what we consider routine, safe pediatric care. And so we're not allowing them to make grand decisions that we feel would obviously harm them. But I hear that you're what I hear from you is you want to make sure your kids are safe and making choices that are in the
I appreciate that. I have great faith. Look, my brother-in-law is a physician. I don't know. I think they're a internal medicine, or he says he's a hospitalist or something. So I know you're not in the business of harming children. I get it. I just have a little bit of a philosophical difference there. And listen, I have to I got to head off to caucus, so I look forward to getting the information. Like I said, I haven't quite made up my mind yet. But you got Katrina here. Please get her the information. Leave me your contact information, and the next time I'm in the district, maybe we can get together. And just FYI, I just want to let you know my last name is pronounced Dolly. So FYI. Okay. Thank you very much. Good luck. Yeah, it's okay.
Way to go, great job.
Did great.
I thought it was
When
going
you
to
guys
be
went-
Victoria,
yeah, when
and
you-
it was just the two of us.
Yeah, when you guys went through your training, you saw all kinds of stuff, right? I mean, 99% of your patients are horses. One of them's a unicorn. So I'm being a little kind of cheeky today, because these things do happen and they do come up. Most of them are going to be very nice, but some legislators that do have an opinion, they might challenge you a little bit. So, some of them just like to spar with you a little bit, which is okay. But I think you did a great job of being completely honest and saying, here's what I'm willing to say and talk about, and this is why we think it's important. You're asking really good questions. You're asking for great information. That information is readily available. I don't have it with me today, but I will definitely get it for you, and I will leave Katrina all of my contact information. So great job.
And Bryce, I lobbied for the Minor Consent for Vaccines Act in Washington, D.C. Several years ago, and everything you said was said to me. We heard every objection that you just came up with. So you're not even that far out of the box.
I don't know if that's a good
Actually,
or a
those
bad
objections
thing.
that killed that bill in the state legislature. So
Yeah, it's like I said, folks, it doesn't matter. You can be right all day long. Oftentimes it just comes down to politics. Okay, we got 10 minutes left, 5 minutes for each group. Who's next? Come into my lair. Who was the other group who actually picked the legislator? Who was the
was
the
immigrant
legislator?
health
Oh,
bill.
Cortese.
Yes.
Cortese.
Hi.
Yeah, how about the Cortese group goes next?
Sounds good. Can you hear me okay?
Mm-hmm.
Super. Senator Cortese, nice to see you. My name is Dr. Botkin. I'm a pediatrician at Santa Clara Valley Medical Center, which is in your district. I also happen to be.
I love that facility. 2 of my children were born at that facility, so lots
Yes.
of respect for that place.
Yes, and I know you had strong support for the institution when you were a supervisor. I also happen to
did.
live in the district and be one of your constituents. And I'm here today to
great.
talk about SB 81.
Okay, SB 81. Mm-hmm.
Yeah. So
Yeah,
as you know,
did you we just recently had that because Anna Eshoo, bless her heart, she finally retired after a number of years. And I'm really excited to see what Liccardo, right? Liccardo is the new congressperson.
yes,
So
Congressman
have you been
Liccardo.
former mayor of San Jose. Have you been to DC to meet with them yet? Do you do this in DC too, or just
I
Sacramento?
have not been to DC, but I have met with him in the district here. And
Oh, you have?
yeah, fun fact, my son went to the same high school that Congressman Liccardo went to. I know he has very deep ties in the community.
Yeah, I was very excited about him. I wanted anybody other than that Evan Lowe to win. I'll tell you that. I mean, we were close. We were close for a while there, but we got kind of a little sideways. So that's great.
Well, listen, I'm here to tell you about my
okay.
support for SB 81. I really hope you can
Okay.
get behind supporting that. It's a really
Mhm.
critical piece of legislation for our community. And what it does is help prevent immigration enforcement activities from taking place inside of private areas of hospitals and clinics. And as I know, some hospitals already have those policies in place, but not all of them do. And we want to make sure patients are safe and secure throughout California. What we don't want is for patients to be afraid of going to the doctor or getting needed medical care because they think they're going to be caught up in some, accidental ICE enforcement activity. And it's really, really important to help patients feel safe and make sure that they're continuing to get the health care that they need.
Mm-hmm. Is that it? Anything else? Well, I appreciate you coming in for and providing me the information. I really appreciate it. And right here is
Super.
Martin Bowie. He's my ledge director. We have the folder, and I appreciate you coming by. And next time, maybe we'll be in DC together, and we can hang out with the good congressman together.
Well, I hope we can count on your support, and let me know if you need anything from information about this particular bill or anything going on at in Santa Clara County in the world of pediatrics. Let me know, please.
1 second, hold on. Yeah. Mm-hmm. I know. Caucus. Okay. I'll have the chicken. Yeah. Okay. Okay. Sorry. Meet up when? When did you want to meet again? I'm sorry.
Yeah, I'm happy to follow up with you in a couple weeks.
Okay.
I'll give you
Yeah.
my contact information and I'll reach out to you to make a plan.
Great. Yeah, I'm up here. I usually drive back. We do session at 9 on Thursday. Kind of goes for a couple hours. I'm usually, I take Thursday afternoon and evening to reintroduce myself to my wife, and then maybe on a Friday we can get together for coffee. I'd appreciate that a lot.
Hey, sounds great. Have a
Great.
good day.
Okay, thank you.
Sounds so good.
I like the personal connection. She picked up on what I was doing. The last thing I want to do was talk about whatever bill she was here to talk about. I had something that I wanted to talk about. I had a constituent here. I wanted to talk about the congressman and that asshole Evan Lowe and that race and everything that went down. And she was kind of, she was shining me on there for a while and made that connection. I don't know if I would have said, hey, listen, that kind of sounds to me like, shut up, asshole. I probably would have said something like, I would love to get together with you in the district over coffee. I would love to tell you a little bit more about my, experience but really, I know you're very busy. I know we only have a couple of minutes today, so I really want to let you know about this really, really important issue for us and stuff. So that was a very good job. I have literally had meetings cut off or people pause meetings because they got to get from one place to the other. And I've literally had members leave the room to go do a vote and come back, or stop the meeting and staff comes in and they look at the menu and they try to decide what they want for lunch at caucus. So depending upon the time of day of your meeting, I know for our ledge day, we're meeting in the afternoon, and they're getting pulled in all kinds of different directions with hearings and whatnot. So just stay focused. I think you did a great job, Leanne. And Cortese's he's a great, thoughtful guy.
He's a very nice individual. I appreciate the feedback, and I will be mindful not to cut people off abruptly.
I love your persistence.
We're used to redirecting. It happens all the time.
Exactly.
And
well, I was the whole takeaway there was I was literally trying to suck all of your 15 minutes by talking about whatever I wanted to do.
Yeah, I could tell you were really into talking about Evan Lowe quite a bit. Listen, I just did it again. Hey, let me just say very quickly, my first name is pronounced Liana. It rhymes with Nirvana.
There you go. Ooh, I like that.
Thank you.
I bet you Senator Cortese, probably not the Dave part, but I'm sure the Cortese has been, my grandfather says, I don't care what you call me, just don't call me stupid. But I love that, Liana. I will never, ever, ever forget how to pronounce your name now. Just like Megan and Brian Dolly.
Thanks, Bryce. Take care.
Mm-hmm.
I think Morgan, Stefan, Victoria, you're using the rest of this time to wrap up. I just wanted to say we had this session last year, shortly before Advocacy Day as well. And at that time, I no longer am at Valley Children's. I'm at Kaiser, Oakland, actually, with Stephanie. But at that time, I still was, and all of our visits were with some of those Central Valley folks. And every single thing that Bryce just described very much happened just in the context of one afternoon with 3 or 4 different legislators. And so I think that ability to think on your feet and just kind of roll with it is really helpful. Our residents were forced to pose with a life-size cutout of Dolly Parton because State Senator Shannon Grove wanted to talk about her literacy initiative. And so just, the ability to kind of roll with it and find the common ground. So this is really, really useful practice. Thank you guys for putting this together.
Can we give a big hand to Bryce for not only the expertise about lobbying, but also, I agree about the Emmy. And thank you to Nikki and Dean Blumberg for stepping in as our subject matter experts. Really appreciate you all. Here are some opportunities. So AAP Advocacy Day that Bryce talked about at the beginning, you can sign up using this link. It's hidden. It's not on the website because they don't want just anybody signing up, but here it is. You came and you can sign up. It's largely going to be residents, but community pediatricians are welcome to join. And it's a really amazing day. There's speakers in the morning. We get together with a small group that we go to a walk and actually talk to our legislators with. And Carmi and the team do an amazing job of trying to set people up with their actual legislators as much as possible too. So if you want to start building those relationships, or maybe you already have them, that would be an awesome event to be able to go to. And then we welcome people to join the advocacy committee. So if you're here, you're not part of the committee, you're not on the listserv, we try to meet about quarterly. And then we also have advocacy blasts. We'd love if you join us. So you can email info@aapcalifornia.org. Thank you. Any other questions or reflections? Feel free to reach out to us, and you could just email that same address there, and it will get to us. We would love to continue to have these sessions and make them even better. So thanks for everybody. We know that you're so busy and appreciate your time.
And if you have to leave, I totally understand. I just added one more link in the chat to the AAP National Advocacy website. One more resource, especially if you're feeling like you want to keep abreast of advocacy opportunities at the federal level. If you scroll all the way to the bottom of this page, there's a mailing list from National AAP around advocacy opportunities. They send out updates weekly and alerts for particular opportunities to contact your federal representatives around important issues around child health. Any last questions or thoughts from everyone? Thank you so much for joining us.
Thanks all. Great job, Victoria. Thanks for facilitating.